Okay, today is Friday, the last day of class, and I apologize. I've separated my shoulder, and it's a very, very painful um, problem to have. I've been to the doctor's office every single day this week, so it's getting better, but I have a long way to go. So I will post the exam later today. I'm sorry we're ending this class on such a low energy, low information final class, but I especially appreciate those who have shown up consistently in the live class. I know some of you could not do that because of your work obligations, um, which is why I give you all an opportunity to watch it on recording. So I hope you learned something from this 15 weeks. I realize that week 14 and week 15 are really generally not of interest to any of you because of the age group that it covers, but we all have parents and grandparents, and then um, we'll have an idea of what's going on in their minds. So I will give you a hint. All of as many as the questions as I can get out of the 20 will be directly on Dr. Elizabeth Kubler-Ross. Now, as the book mentions, and there are other videos on Facebook that tend to disagree with Kubler-Ross on these 5 steps of death and dying. But let me say, she was the first one to come up with this plan, and she has a lot of international followers. She herself is just a tremendous clinician. As a medical doctor, she got involved in this, and she got involved in it because when she was a resident and you were assigned patients when you're a medical doctor doing residency because you've already graduated from medical school. And depending on what your specialty is, going to be another 4 or 5 years of residency. But what happened is she, like most of her cohorts, didn't like seeing the patients that were in palliative care, which means there's really not much they can do for them. Maybe they're on pain meds, which is what I am on, and they're basically waiting to die. Sometimes they, of course, they get discharged and go to a hospice care or something. But they're the kind of patient that nobody wants to see because there's no hope for them. They've been designated as in the vernacular we say in the checkout lane. They're like the grocery. You're just ready to check out and go. So Kubler Ross used to save those patients to the very end of her day, so she couldn't get depressed or complicated. Oh, there's Victoria. Hi, Victoria.
Hi,
Thank,
sir.
thank you for showing up. I was just talking about Dr. Kubler Ross and giving you some advice that as far as the test goes, if I can find 20 questions that are all on Kubler Ross, then that's what I'm going to put on the test. Um, and I was discussing that Kubler Ross got involved with the death and dying because she was a resident. I think she was a family practice resident, although she might have been in psychiatry. I don't know. She's a really smart lady. And most people, most of the physicians don't want to see these death and dying patients because there's no hope for them. They're on, they're dying of cancer or some other terminal disease. They've already tried everything they could try. So there's no optimism. There's no sense of a physician coming into a room and talking to somebody and talking about how their blood work looks better, or um, the cancer shrinking, or the operation was successful, and they're all those things that doctors like to do, which is save people's lives and save them the pain that they may be going through. All those interventions which have made a difference in the patient's life, and they're going to get discharged and go home. Well, these patients are not going to get discharged alive. They're going to get discharged probably dead, or maybe they'll get discharged to a hospice care, which is just a lower level of care because you don't need the medical care. Maybe you obviously are still on um, pain drugs or something like that. And she left them for the end of the day because she didn't want to get depressed early on in the day about some patient slowly dying. And what happened was she sort of gained an appreciation because you're not really doing any medical intervention other than what's already there. So she ended up just talking to him or listening to him, I guess would be a better description. And at the end of life, a lot of people go through their whole life, all their relationships, all the things they've done, their family, and all those kinds of things. And she found it to be very empowering if you just let the patient talk, which is generally not the way physicians act. They come in, they diagnose, they intervene, and then they leave. There's really not a whole lot to talk about except how are you feeling, to give the doctor an idea as to whether the medication or the treatment, the surgery was a success. Well, with a palliative patient, all you're doing is keeping them as comfortable as you can until they die. So that. In fact, that's a whole area of treatment specialty within nursing, or in the medical doctor point of view. It's called palliative care because really all you're doing is making them feel comfortable before they die. Well, she was inspired by listening to these patients and giving them more time than she did her patients earlier in the day, where, like I said, traditionally you go in, look at their chart, talk to them, and then get out and go somewhere else. And by not being in a hurry and not talking about medicine, and it was a different kind of experience. So every basically everyone in her residency class hated, just like she did in the beginning, hated seeing these patients. So they would trade her and they say, hey, well, if you go see Miss Garcia in 107, then I'll take your uh, pulmonary case, on the pulmonary ward, and because they didn't want to see these people either. So when they found out that Kubler Ross was really sort of getting into this, they all wanted to dump their patients onto her so they wouldn't have to see her. So that's what happened. She basically started seeing even more um, patients that were basically receiving palliative care, and she enjoyed it more and more. and it sort of made her revitalized in the way that doctors want to be helpful. And in this case, you can't really be helpful medically because you've already tried everything that you could try and it didn't work. So she was sort of acting more as a psychiatrist, helping with listening and list and uh, validating this person's life because you may be the last person they see if they don't have family coming to see them, or again, most hospitals will allow you to be in the hospital 24/7, but unfortunately, some people don't have relatives or they don't have relatives interested enough to come because it's depressing to them. It's sad. Every time you go see grandma, she looks worse than the last time you saw her, and so it's not much fun. So she became sort of famous for this and gave a lot of speeches and lectures on it to other physicians and other care. In fact, one of the videos that I had is talking to a group of nursing students. And of course, then she wrote the famous book that she wrote on death and dying, and she became an international in demand speaker about that. And so she's, in my opinion, been the most influential medical professional dealing with death and dying. So I have a lot of respect for what she has accomplished. I will say that there are people who don't agree with her, and um, you can watch their countervening opinions on YouTube, or the book sort of donates about a paragraph on it. Oh, anyway, um, we end up with death. We start with life, and we end up with death, and that's how the course ends. So I apologize for my absence this week, but trust me, I've been in the doctor's office every day this week, and I am in better shape than I was yesterday or the days before, but I have an ice pack on right now, which is helping somewhat. So I will take it easy and get better this weekend, hopefully. Again, my last message to you would be if you're missing exams, let me know and I will put them up so you can take them. So I greatly appreciate you showing up, Victoria, especially since I wasn't even here yesterday. I was in the doctor's office. Um, do you have any questions on the study guide?
Um, I'll check right now. But I was gonna ask you, do we have a writing assignment or was that not posted?
No, I guess I never did post that. So don't worry about it. You did the
Oh,
first one, right?
yes, I did the one. It was like Valentine's, right? The attachment.
Yeah.
Yeah, I did that one.
All right. Well, that'll be your gift for the end of the semester. Thank you for reminding me that. So any of you who are actually going to watch this video, um, I'm glad you remembered that. I didn't at the time, so it's all good. Um, Again, as always, you can still, if you come across a question that you're in doubt about, you can always email me. I am answering my emails. Um, but I will, I'm telling you that I will put every um, Kubler Ross question on the exam. Hopefully, I can come up with 20 of them. And so that's a little insight. Okay, you've got,
Number 40
and
is good deaths or blank.
good death is one that's not painful.
What is considered a good death?
Okay, well, let me look up that question since I didn't. Oh my God, look at all this crap. Okay. I don't know why this thing is really moving slow today. Okay. Good deaths. Ha! Yeah. Good deaths are free from debilitating pain. That's uh that's B. So 40 is B. I sort of joked that that was going to be the answer. Of course it is. Nobody likes going out of this life in pain because none of us like pain to begin with. And you'd hate to think your last moments on earth, you're in excruciating pain. I have been in excruciating pain this week, but I don't anticipate dying from it. Um, but it it really is um, ugly. So a good death would be one when you're, because of the medication you're taking, you're not in pain, so you have time to talk about the past and things that are important to you. Um, I don't know if you've got a chance to watch her videos, but one of them is very long. It's over an hour long, but she is very captivating. What are you in the nursing program, Victoria?
Yes, I am.
Thought so. So it would be especially important to you because when you do your rotations, you're going to have to work on that unit that's got the terminally ill patients on it. So because the way you as a medical professional approach a terminally ill person, it's different than how you would approach any other patient. Because with any other patient, you're very concerned about whether the treatment is working and whether something else has popped up. Because, as you know, you go in the hospital for one reason, and it might um, end up that you've got something else going on with you. So you're always interested in assessing the patient, diagnosing the patient, again, reassessing the patient. But that's not the case with um terminally ill folks who are just trying to. I mean, you can find out whether the medications are working because sometimes um, the pain is can be maintained by a certain level of medicine, and then it's not working. So maybe you need to increase the dose or maybe even change a med or add a med to make things better. So there's some diagnostic assessment going on, but not like a non-terminal patient. Non-terminal patient, you were definitely interested in all their vitals and how they're feeling, and you know what they eaten and how their body elimination is going, and checking the chart and all that stuff. But it's a little less important when you've already received all the medical assistance and intervention that you can, and it's not work. It maybe extended your life some, but it didn't. It's not like a patient that's going to totally expect to be discharged. So we'll see what you think when you get in that situation. Maybe you'll remember something about Elizabeth Kubler-Ross. Kind of a squirrely looking lady, I have to say. Um, she was, I can't remember what country she was born in, but she's not a Native American. She's born in Europe. So, interesting lady. Very, very caring, charismatic for sure. No wonder her patients loved her. And obviously, her fellow residents loved her because she took all their death and dying patients away from them. So, they loved her for that. And her patients benefited from it. It's a good example of, there's lots of examples, not just in medicine, but other walks of life, occupations, where you get involved in something and you think one way. This happens in, of course, medicine and all the specialties. You think you really want to work OBGYN or something, and then you end up working in neurology, and you thought, neurology, why the hell would I do that? Something clicks, and it changes your focus on how you want to apply yourself as a medical professional. It happens all the time, even in nursing or in being a medical doctor. Um, you think you really like something, and maybe you do, but then you get exposed to something and um, change your mind about what kind of patient you want to work with. Oh, that's my phone from somewhere. That one doesn't work. I can't use that that arm too well. Okay. Well, text me if you need anything. Thanks for being a good student, showing up most of the time. So take care. Have a great summer. We'll see how
Thank you, sir.
we'll see how fall works out. I have my doubts. All right. Take care. Have a
too.
lovely break if you're not taking summer school.
No, I'm not.
All right. Well, get fired up for fall. It'll be better.
Alrighty. Thank you, sir.
Thank you.